all for joining us today. 1 year ago, on March 3rd, 2020, I was pleased to join our Deputy Premier and Minister of Health, Christine Elliott, to launch Roadmap to Wellness, a plan to build Ontario's health and addiction system. As the name implies, this roadmap provides a path to building a mental health and addiction system that offers Ontarians better access to higher quality care when and where they need it. It reflects the priorities we heard again and again through our conversations with hundreds of experts, frontline providers, individuals with lived experience, as well as Indigenous leaders and communities around the province. These conversations took us from downtown Toronto to Ontario's far north, including many remote Indigenous communities. I remember hearing the stories of those who battled with mental illness and addictions for years, only to be faced with barriers to accessing high quality and culturally safe mental health and addiction supports close to home. As Ontario's Associate Minister of Mental Health and Addictions, I have also heard the struggles of so many individuals and families during the COVID-19 pandemic. Simply put, we recognize the immediate need for higher quality and culturally safe supports for Indigenous people in Ontario. That's why I'm pleased to announce that our government is providing over $12.8 million to expand and enhance culturally safe mental health and addiction services for Indigenous people and communities. This includes nearly $7 million for community-based and Indigenous-led mental health and well-being services for children, youth, and families. This will be used to expand programming for Indigenous children and youth in care under the Family Wellbeing Program. It includes over $1 million for enhanced mental health and addiction services in Indigenous primary care teams. We also are investing over $1 million to help address the long-standing gaps and barriers that Indigenous students and their families experience in the school system. Over $1 million in annual funding over 10 years to support the creation and implementation of 11 new social emergency manager positions in Anishinaabe, Aski Nation, and Grand Council Treaty Number 3 First Nation communities. Over $1 million for the expansion of a child and adolescent psychiatry program based in Thunder Bay with satellite service locations across Northwestern Ontario, and $900,000 to support additional Indigenous-focused mental health and addiction services and programs related to community safety and education. By making these investments today, we're taking another significant step towards building a mental health and addiction system for the future, a system that is client-centered, culturally sensitive, accessible to all, and connected. This is what Ontarians want and should expect from their government to ensure their mental wellness. And I'd now like to turn it over to Minister Elliott, our Deputy Premier.
Well, thank you, Minister Tibollo, and hello, everyone. I'm Christine Elliott, Ontario's Deputy Premier and Minister of Health. Our government has made a commitment to build a comprehensive, connected, and integrated mental health and addiction system that works for everyone in Ontario. Today's funding announcement continues to deliver on that commitment. Now, more than ever, it's critically important to ensure that people across Ontario can access the safe and effective mental health and addiction services they deserve, when and where they need them. That includes Indigenous communities. The funding we're announcing today is part of an additional $176 million we have provided this year as part of Roadmap to Wellness, our comprehensive plan to deliver high-quality care and build a modern, connected, and comprehensive mental health and addiction system. Roadmap to Wellness is a plan built from the ground up through meaningful consultation with stakeholders across the province, including, of course, Indigenous leaders, communities, and people with expertise in Indigenous mental health and addictions, grassroots community organizations, frontline healthcare providers, health system leaders, experts and advocates, and of course, people with lived experience of mental health and addictions issues, their families and caregivers. Roadmap to Wellness was created to address the long-standing concerns that we heard. Wait times were too long, People did not know where to get help, and they found it hard to understand and navigate the system. Today's announcement demonstrates our commitment to working with Indigenous communities and other health system partners to address these long-standing challenges. This funding will enhance and expand existing services, improve quality of care by merging traditional Indigenous knowledge with healthcare best practices, and improve access to care for those who need it. We will continue to work collaboratively with Indigenous partners and communities to co-develop programs and services that will enable Indigenous peoples to access high-quality, culturally appropriate mental health and addiction services across the continuum of care. During these challenging times, we stand committed to ensuring that people in all corners of this province are fully supported in their journey to mental wellness. That's why we've also invested $194 million to immediately expand access to high-quality mental health and addictions care during the COVID-19 pandemic, including the many online and virtual supports being used by over 57,000 people across the province. To close, I want to reassure everyone that as our government works to expand mental health, addictions, and well-being services, we will continue to support Indigenous-led initiatives that are community-driven and use a holistic approach to address critical areas of need. We look forward to our continued collaboration with our Indigenous partners. Thank you very much.
Thank you, ministers. That concludes the formal part of our announcement. We'll now move on to media Q&A. As a reminder to media, it's one question, one follow-up. Operator, first question, please.
Ladies and gentlemen, as a reminder, should you have a question, please press star followed by followed by 1. Okay, it appears there are no. Yes, we do have a question from Carmen Gurlo from CBC News. Carmen, please go ahead.
Good afternoon, Minister. My question is in relation to a recent executive officer notice that was sent to pharmacies about asymptomatic testing. It clarified that visitors to retirement homes are not eligible to get an asymptomatic COVID-19 test at pharmacies. I'm wondering why not, Minister?
Anybody who wants to be tested can be tested. We are doing asymptomatic testing at our pharmacies, and that if someone is concerned that they may have been in contact with someone with COVID, or that they're concerned if they've received some kind of a notification on using their COVID app, then they can receive a test at a pharmacy or one of our testing centers.
Follow-up, please.
It's just we've been in touch with a woman who was not able to get that asymptomatic testing at the pharmacy that she's been going to. So I'm just wondering, Minister, then if she was not able to go there, what are the options for people? Where can they go? We have heard concern from primary caregivers about getting a COVID test alongside people who may be symptomatic. I'm just wondering, what are the safe options for them? Where can they go?
Well, I'm sorry that she was unable to receive a test at the pharmacy. Perhaps they were not participating in the program and weren't doing the testing, but we do have the assessment centers. We have over 170 of them across the province. So if she's able to go to one of those centers and wears her mask and so on, she can certainly be tested at one of those centers.
Thanks so much. Operator, next question, please.
Your next question comes from Melissa Candelaris from Your TV Halton. Melissa, please go ahead.
Hi, Deputy Premier. Thanks for taking my call. I just wanted to ask, with the AstraZeneca vaccines coming, it was indicated, as you know, that those over 65 shouldn't, it's recommended that they don't get it. And when Dr. Tam was asked about maybe switching up the age groups or maybe giving it to more marginalized Canadians, or Aboriginal Canadians as well. Is there a sense, and Dr. Tam initially said that it's up to the province, so are you taking that into consideration when trying to distribute the AstraZeneca? Will you be looking into tweaking the age group as to who might get it or the types of groups that might be able to get it?
Well, the recommendation that has currently been made in Canada, Melissa, is that people over 65 should not receive the AstraZeneca vaccine, that it is more effective for people of younger years, although I certainly recognize that they are changing the guidelines in other countries, Germany and France, but in Canada right now, it is not recommended that people over 65 receive that vaccine. But we do have Pfizer and Moderna still coming in, which are appropriate for people over 65. And when we receive large numbers of vaccines, we will then be shipping them out to various locations. We may be using AstraZeneca in some of the pharmacies that are going to be participating in the vaccine program, but it really depends on when we receive the vaccines and how many of them that we receive. But we expect to distribute all of them broadly across the province.
Follow-up?
Great. And just another question that perhaps you might be able to dispel. There's been some kind of activity on Twitter. Halton citizens have been reaching out to our regional chair, criticizing them for the lack of vaccine rollout here in our region and why we're taking more time compared to other regions. And the answer that was received was that the vaccines, our share of vaccines, or part of it, was taken away from Halton to give to the more affected regions like Toronto and Peel. Is there any validity to that? Is there any truth to that? I just want to get that out of the way.
No, all areas have been receiving volumes of vaccines based on their populations. And so there were some situations earlier on when we had the shortage of vaccines from Pfizer and Moderna, where we needed to move some vaccines around in order to make sure, for example, if people were given the first dose of Moderna, we needed to give the second dose of Moderna to them as well. So some of the vaccines were moved around, but no part of the province was shortchanged at all in the vaccines that they received. Everyone received volumes based on their population. So if some vaccines were moved from Halton, maybe they were Moderna, they would have been replaced by Pfizer vaccines.
Thank you so much, everyone. That concludes today's announcement, and thank you very much.
Thank you.